Hi everyone, Dr. Waite here, and today we're going to be continuing on our discussion on the subject of neck manipulation and stroke. Now, as I shared earlier this week, no studies have found a causal link. What we believe is happening is that somebody who has neck pain or headache is seeking out care for those symptoms, and they're either going to a chiropractor or they're going to a medical doctor or a medical professional. Now, because I'm a chiropractor and I know that it's a possibility that somebody's coming in with those symptoms and that they're in those early, potentially in the early stages of a stroke, and that's why they're having the symptoms, then I'm going to tell you a little bit about what we do here in the office to rule that out as much as we possibly can through different tests. Now, the first thing we're going to do, of course, is we're going to ask the patient about their symptoms, and we're going to check in with them to see if they have any other symptoms that are commonly associated with a vascular injury or stroke. And we're going to make sure that they're not either A, having those symptoms, or B, maybe have had those symptoms in the past. If those are all clear, then we're going to move on and we're going to do some testing. So we're going to check their blood pressure and we're going to see side to side, do we have a big variation that could potentially be due to a vascular injury in the neck or a stroke. And we're going to check their balance. We're going to check how their brain is functioning. So we're going to check their balance, check their eyes, check their movement, and make sure that everything is clear there. In addition to that, I do something called the passive range of motion test, where you have the person lie on their back on the table, head is off the table, I'm holding the head, and I'm just slowly moving it in a full range of motion, and I'm checking with them to see if it's causing them to have any symptoms that we would commonly associate with a stroke. And I'm also kind of looking at them and checking how their face looks and how their eyes look, and making sure that we're not seeing any of those symptoms that we might commonly associate with a stroke. So at my office, the best thing to know is that if you are coming in with neck pain or headache and you don't want to have your neck adjusted, we actually don't have to adjust your neck. We have a lot of really great tools available in our toolbox to be able to help you with your neck pain without adjusting the neck if that's something you really don't feel comfortable with, and that's okay. I'm not going to be offended if somebody says they don't want to have their neck adjusted. So hopefully that answers some questions for you of how we can best rule out the possibility of somebody having a stroke here in the office and give you a little bit more comfort and I guess a little bit more information to know if you're going to see a chiropractor, kind of what you should be expecting from their exam to be able to rule out that you're possibly having your symptoms because of a stroke. So that's it for me today. Of course, I always love talking with you, and we'll talk to you next time. Have a great one.